Hi, I'm Tom Faerber. I'm a board-certified oral and maxillofacial surgeon. I've been practicing in Overland Park for 32 years. And today we have Joan, who went through quite a bit with her upper two front teeth. Joan had some old failing root canal teeth with inflammation and bone loss. And it was quite a protracted procedure. We're first taking those teeth out and doing bone grafting, reconstructive bone grafting. And then I think we waited 6 months at least to do the implants. And then did the implants and then did another surgery, soft tissue exposure. So it was quite a long treatment plan, and wanted you to maybe discuss a little bit how it went for you.
Yeah, well, it was, the end results are great. So, and the process actually, because you outlined it so well, how it was all going to go, it went really, really smoothly. So when I first started, my bone had all deteriorated so much my teeth were actually already moving in the front when I came to you.
I remember that, Well, and it's an area that a lot of patients don't understand if they're not trained in it, but dental implants close together, there can be surrounding bone loss and issues. So we always worry, especially in the upper front of the mouth, putting implants in tight proximities, because you can have some creeping bone loss over the years. And actually your follow-up CT scan today looks great.
Wonderful.
The bone looks really good. But that's why we had to break up those procedures too, was to make sure the bone volume was going to stay pretty stable. How was your pain level with those different surgeries?
I didn't have that much pain, actually. I was expecting a lot worse than what actually occurred. So that was probably good that I anticipated the worst.
How did you wearing the temporaries? Because that's always a hassle.
Yeah, the temporaries piece wasn't a big deal for me because I really don't remember it much. So it must not have been that big of a deal.
Yeah, okay. And I think we did sedation for you because it's a pretty sensitive area.
Yes.
How did the anesthesia go for you?
Oh, very well.
Okay, all right. And swelling, those issues, did you have a huge amount of swelling, or do you remember?
I really didn't.
Okay.
I really didn't. And I think the fact, again, that I knew what was happening and why it was really a complex process helped me set my expectations well in terms of what I might be feeling, the reason behind it, and that was really helpful.
Yeah. Did you feel a little more comfort since we have an accredited office-based surgery center? Did that give you any more comfort, and as well as our outside anesthesia staff?
Yes, it did, because my dentist, when I first went to him, it was my first visit with him when he realized there was this really complex case, and he referred me to you, and I think he mentioned that as a way of reassuring me that this was the best next step in my care.
Okay, good. All right. Well, we're happy everything's gone well. That's always nice to see. But we also like patients to know that a lot of these procedures aren't overnight.
Right.
And they do take a while to make them each step very safe progression and reduce risk, because implants that are next to each other, especially in the front of the mouth, there can be some bone loss. So taking it step by step made it a nice procedure for you.
Yes, and we thought of it as, this is an investment in my teeth for the next 40 years. So 40 or 50-year teeth is what I was hoping to get.
That's what we hope we get to.
Yes.
Okay. Well, thanks for coming in today.
Thank you. Appreciate it.
It looks fantastic.
Yes, it does.
Okay. This is a professional case discussion on patient Wells. This patient has a history of old trauma to her upper maxillary incisors number 8 and 9. And then she went on to have subsequent root canal and crown restoration procedures. The teeth eventually developed ankylosis, and then she experienced root fractures and chronic inflammation, along with unfavorable anatomy of minimal labial plate thickness and fenestrations to the labial plate over teeth 8 and 9. Both the maxillary incisors were extracted and received socket preservation bone grafting, which was enhanced with growth factors. She regenerated abundant bone after this procedure, and after 6 months, bone regeneration was very favorable and implants were placed after 6 months with additional bone grafting. The end result after 6 years demonstrates excellent aesthetics and bone and soft tissue preservation.